Hi, this is Stephen-Castro, and we are going to go over the care of patients with acute coronary syndromes. It's chapter 38 in your book. Our priority concept is going to be perfusion. That also has the exemplars of stroke as well as dysrhythmias, and some interrelated concepts include comfort. Coronary artery disease includes stable angina and acute coronary syndromes. Those terms are interchangeable, and we'll talk about that more in a minute. I do want you to note the difference between ischemia versus infarction. Ischemia is a lack of oxygen to that heart muscle, whereas infarction is actual cell death of that heart muscle due to ischemia. Stable angina pectoris is the technical term for cardiac chest pain. It's a temporary imbalance from ischemia. There's lack of oxygen to that cardiac muscle. The supply is not meeting the demands. It's only temporary and typically doesn't cause permanent damage. Conversely, you have acute coronary syndrome, which is caused from unstable angina and can lead to acute myocardial infarction. Unstable angina, that plaque is not fixed. It can cause ruptures, platelet aggregation, and thrombus. This can also lead to acute myocardial infarction. Unstable angina is chest pain that isn't relieved with rest, and nitro may not help it either. There are a few different terms that fall under this category. That's new onset angina, Prinz-Metal's angina, pre-infarction angina. Patients typically don't have elevated troponin levels with unstable angina, but they will have EKG changes. Myocardial infarction is the most serious acute coronary syndrome. The tissue is abruptly and severely deprived of oxygen. Usually 80 to 90% of the blood flow is occluded. This will lead to ischemia, or lack of oxygen to the heart muscle, which causes the muscle to be injured, and the cells will eventually have necrosis or die. The American Heart Association divides myocardial infarction into two different categories. You have your non-STEMIs and your STEMIs. The ST elevated MI is just that. You see ST changes on your EKG, where your non-ST elevated MI, you may not see those elevations. You will have some other changes. We'll go over dysrhythmias later, but just to give you kind of an idea, that top EKG segment shows a normal EKG pattern. The second one shows the ST segment is elevated, whereas the bottom. Here is an anatomical review. Pay attention to the right coronary artery, how it's on the right side and wraps around that right ventricle. You have the left main, or the left coronary artery. Then you have the left anterior descending, which wraps around the left ventricle. Here's a few questions I want you to think about. The answers are listed in your book on page 771. The primary underlying cause of coronary artery disease is going to be atherosclerosis. And they do address that a little bit in some other chapters in your book, as well as this chapter. Just pay attention to what's modifiable versus what's non-modifiable. Those non-modifiable risk factors we can't change. Here's a list of some modifiable risk factors for coronary artery disease. These are all things that can change with lifestyle changes or enacting some healthy habits. If the client's unstable, the history may have to be delayed for another time. It's important to begin your physical assessment as soon as possible, including a thorough pain assessment and vital signs. Also assess the heart rhythm on EKG, heart sounds for any additional heart tones, and check the peripheral pulses as well as skin temperature. A client with acute coronary syndrome will have a variety of labs ordered, but the cardinal lab for acute coronary syndrome or myocardial infarction is going to be the troponin. The troponin is an enzyme that's released from the heart muscle when there's damage done to that muscle from ischemia or infarction. Additional tests may include images such as a chest x-ray or CAT scan. They're going to need a 12-lead EKG within 10 minutes on arrival to the hospital or within 10 minutes of presentation of chest pain. They may end up going to the cardiac catheterization lab. Once assessment data is collected, it's time to interpret that data and identify any potential priority problems for your client. These may include acute pain, decreased myocardial tissue perfusion, ability to cope. Your nursing implications are going to revolve around reestablishing cardiac perfusion. Do not delay the EKG or the labs, but some of the medications you may give for acute coronary syndrome include nitroglycerin, morphine, oxygen. Put them in semi-Fowlers and try to keep them calm. There's a variety of pharmacological agents that will help with reperfusion therapy of the cardiac muscle. Please review the list on chart 38-4. Also include your reperfusion therapy, the fibrinolytic therapy, such as fibrinolytics, as well as PCI. Once reperfusion has been established, the client will go through a few phases through their rehabilitation. We also have to be able to identify and manage dysrhythmias. Pre-hospital dysrhythmias are like the leading cause of deaths with clients with acute MI and acute coronary syndromes. It's important to monitor for heart failure because it's a common complication after an MI, specifically that left ventricle. It's the most common, but you need to identify or know the signs and symptoms of heart failure and monitor for cardiogenic shock. Hemodynamic monitoring may also be indicated for some of these more critically ill clients. This is a quick video of a PCI. What you see here is dye being infused through the coronary arteries. If you can see the dye that goes through free flowing, that means that the arteries are nice and open. If there's an area where the dye doesn't make it through, that means that artery is blocked. Once they've established the artery that's the problem, they can do a couple of things. One of the first things they can do is to use a balloon to open that artery up. They insert the guide wire, inflate the balloon, and that helps keep that artery unoccluded. This is a video representation of a stent. The cardiologist, again, will introduce this into the area that's affected through the guide wire, and they will open up that stent, and that will help keep the plaque open or open up that artery to improve blood flow or perfusion. Coronary artery bypass graft is a surgical procedure that may be indicated for clients that don't respond to other therapies through PCI. This is a surgical procedure where they harvest typically the mammary vessel and create a new blood flow to the heart tissue. This is a video representation of a cardiopulmonary bypass machine that's used during surgery for coronary artery bypass graft. The primary vessel that's used for a CABG, again, is going to be that internal mammary artery graft. But if there is triple vessel disease where it affects all the vessels, they may need more than one graft. So at that point, they may have to use the saphenous vein. Review the care of a client going under the coronary artery bypass graft procedure, and also post-procedure and what complications you need to monitor for. They're listed on page 787. There's also a bypass graft called a minimally invasive direct coronary artery bypass, and it's done with a smaller incision versus a full open thoracotomy. They're able to do it endoscopically, and patients typically can heal a little bit easier. Due to the risk factors and underlying health issues, these clients typically need some type of a case manager to help them transition to home management. It's an interdisciplinary approach. There's going to be a lot of education also needed on lifestyle change, modification, as well as pharmaceuticals. Your evaluation or your reflection should revolve around the priority problems that you identified with your patient with coronary artery disease. This may include that they are pain-free, that their perfusion has been improved, as well as being free of any cardiac dysrhythmias. Over the next few slides, there is a brief case study as well as some questions regarding this concept and exemplar. We'll go over some more information in class during some activities.